So good morning, everyone. Thank you once again for joining us for our monthly NAMP webinar. This morning, we have a very special guest, Dr. Obed, one of the very strong women in this profession in Nigeria. She'll be speaking to us this morning on the topic, Advancing Medical Physics Profession through Training, Research, and Innovation. So I'm just going to read Dr. Obed's brief biography before I hand over to her. So Dr. Obed is currently an associate professor at the Department of Physics, University of Ibadan, Nigeria. Her areas of research include imaging techniques and patient dosimetry in diagnostic and therapeutic radiological procedures. She has about 25 years of expertise in radiation protection and dosimetry for patients undergoing medical procedures. Her research work involves the estimation of radiation dose from medical exposures in order to generate reliable dosimetry data for use in epidemiological studies of ionizing radiation and cancer risk. In 2010, she was a recipient of the prestigious Takibinesh Award at the International College of Medical Physics for her significant contribution on medical physics research under the Training and Research in Italian Laboratory Program at the Abdusalam International Center for Theoretical Physics, ICTP. She was the best research fellow for the past 5 years in 2010. She was also an IAEA fellow at the National Physics Laboratory from September to December 2001, a junior associate of ICTP from 2012 to 2005 to 2012, I beg your pardon, a regular associate of ICTP from 2014 to 2019, and she's currently a member of the Organization for Women in Science for the Developing World, a member of the Nigerian Institute of Physics, and also a member of the Nigerian Association of Medical Physicists. Dr. Obed teaches radiation and health physics topics at the university level. She's also involved in medical physics education program. She has successfully supervised quite a number of PhD students, masters, and BSc students, some of whom are currently working as medical physicists in both private and government institutions, locally and internationally. Dr. Obed is currently a Nigerian Nuclear Regulatory Authority accredited radiation safety consultant and advisor. You can see why I say she's a very strong woman. So that is who will be speaking with us this morning. Thank you so much, Ma. We are very privileged and happy to have you speak with us this morning. So over to you. Thank you, Ma.
Thank you, Dr. Uwadiaye. Thank you very much for the introduction. I'm going to talk about advancing medical physics profession through training, research, and innovation. And this is the overview of my presentation. I'm going to be introducing the topic. I'll talk about challenges facing medical physicists, the roles and responsibilities of medical physicists, the academic education and clinical training of a clinically qualified medical physicist, training activities in medical physics. I'll talk about research and development, then the future roles of medical physicists, then I'll conclude. Introduction. There are about 6 different areas of medical physics. There is this, and as we may all know, medical physics represents a bridge between physical sciences and medicine, especially between physics and medicine. So there are different areas of medical physics. We have the radiation oncology or radiotherapy, and radiotherapy is divided into 2 parts. There's external beam therapy and there's brachytherapy. So we have diagnostic and interventional radiology. There is this area of nuclear medicine. There's the area of non-ionizing radiation, which is medical resonance imaging and ultrasound. Then we have medical health physics and physiological measurements. But for now, the focus or emphasis seems to be on the first 4 areas of medical physics. Then medical physicists have 3 components of work: clinical service and consultation, research and development or innovation, then teaching or education and training. Increasing incidence of cancers, cardiovascular diseases, orthopedic disorders, and other degenerative conditions present a pool of patients who would need medical imaging and radiotherapy procedures for adequate health care. Globally, Africa is one of the continents with very low number of medical physicists per million population. Africa has about 0.6 medical physicists per million, less than 1 actually, compared to Europe that has about 30 medical physicists per million, and USA, Canada that has about 26 medical physicists per million. In 2020, Nigeria had about 100 medical physicists on register for a population of about 200.9 million. That's still less than 1 person per million. Whereas Ghana had about 58 medical physicists for a population of about 31.1 million. That's almost 2 medical physicists per million. The reference is shown below. The activation of the Nigerian Nuclear Regulatory Authority, NNR, in 2001, and the National Institute of Radiation Protection in 2006 has brought to limelight the importance of medical physics in Nigeria, especially in the health establishment, as well as the implementation of radiation protection in the industrial sector. IAEA, WHO, IAEA is International Atomic Energy Agency, WHO, World Health Organization, ICTP is International Center for Theoretical Physics, and IOMP is International Organization for Medical Physics. These organizations have been supporting medical physics in Africa. And from Ige et al. 2020, there is this radiation medicine equipment distribution in Nigeria. Under radiotherapy, we have, in 2020, we had about 10 teletherapy machines in Nigeria. That's LINAC and Cobalt 60 machines. And there were about 6 brachytherapy machines as low dose rate and high dose rate machines. Under diagnostic and interventional radiology, I think the number of general X-ray units are uncountable, I don't know, but it was not given in this publication. The number of CT machines available in Nigeria then was 150. Then fluoroscopy and interventional radiology equipment, about 8. Mammography machines, about 50. Under nuclear medicine, we have the 2 SPEC machines and 1 SPEC CT and no PET CT. So this is the distribution of the radiation medicine equipment in Nigeria as of the year 2020, according to Ige et al. Publication. So there are some challenges that face medical physics profession in Nigeria. One of them is lack of recognition of the medical physics profession by the authorities in Nigeria. There is this Education, Medical Physics College and Medical Physics Regulatory Council bill that has been pending in the National Assembly for, I think, close to 10 years now. And it was only of recent that our contact in Senate advised us to split the bill into 2. That we should have the one on regulatory council and the one on college separately. And the advice was followed. So we hope that something good will come out of that very soon, so that we can have Medical Physics Regulatory Council bill, passed, and we can also have the Medical Physics College bill passed. Another problem or challenge facing medical physics profession in Nigeria is the residency program in medical physics. I think there has been a voluntary residency program, but in radiotherapy only. And this too has been plagued with lack of adequate funding and delayed legislative instruments. And the number of positions available for appointment of medical physicists are also limited. Training facilities available for medical physicists need upgrade. A lot of them need upgrade. So having considered the different challenges faced by medical physicists, we know that the lack of recognition of the medical physics profession is a challenge internationally. Actually, it's a challenge internationally. That is why the International Atomic Energy Agency has been able to develop a publication. Let me pick my highlights. Excuse me. The Human Health Series, IAEA Human Health Series number 25, has been written by IAEA to try to solve this problem. I was trying to pick a highlighter, but it's not working, don't worry. The Human Health Series number 25 is a publication of IAEA in the year 2013, and it talks about the roles and responsibilities of clinically qualified medical physicists. The roles can also be found in the IAEA International Basic Safety Standards. But this publication was produced by IAEA in an attempt to promote the profession, the medical physics profession internationally. So in the publication, we can find the different roles and responsibilities of clinical qualified medical physicists. The publication defines approximately and explicitly the roles and responsibilities in different specialties of medical physics related to the use of ionizing radiation, such as radiation therapy, nuclear medicine, and diagnostic and interventional radiology. The publication also established the criteria that supports the harmonization of education and clinical training worldwide, as well as to promote the recognition of medical physics as a profession internationally. So the role of medical physicists in all specialties are listed in the IAEA Human Health Series number 25, and it involves calibration and verification of measurement instruments. Medical physicists are supposed to calibrate their instruments periodically. Then the technical supervision of equipment and equipment operation and maintenance. The clinically qualified medical physicists are responsible for establishing acceptance and commissioning procedures for diagnostic, therapeutic, and measurement equipment. They are supposed to collaborate with service engineers for the coordination of preventive and maintenance programs and supervise their implementation. You know, medical physicists are supposed to perform quality control measurements of every equipment that had just been repaired before they put it back into use. So that's part of our role, the role of medical physicists. Then records and documentation is also part of the role of medical physicists. Medical physicists are responsible for the documentation and records on maintenance, calibration, and performance of all the equipment in their area of work. Then when it comes to clinical computing and networking, they are supposed to collaborate with computer engineers for the verification of network integration and data transfer to ensure that all systems are functional. Then when it comes to research and development, medical physicists are expected to evaluate new technologies and investigate the adoption of new procedures. We are supposed to carry out research and development in medical physics. And when it comes to education and training, we are supposed to teach, deliver lectures, and train junior medical physicists in the field. So these are just the summary of the role of medical physicists in all specialties, that is in radiation therapy, in diagnostic and interventional radiology, in nuclear medicine, and so on. So there is a minimum requirement for the academic education and clinical training of a clinically qualified medical physicist. And why are we particular about clinically qualified medical physicists? The evidence of clinical training is becoming more important in order to satisfy health authorities that an acceptable degree of competence has been attained to practice independently as a clinically qualified medical physicist in a hospital. So that's why it is very important to have this training and education. So we are looking at the basic degree. The minimum requirement for this education is a basic degree in physics. When you have a basic degree in physics or equivalent academic degree that takes about 3 to 4 years, You are expected to go on for a postgraduate program in medical physics that takes up to 1 to 3 years, depending on the university or the academic circle in the university you plan to attend. But if you already have an MSc or PhD in physics or equivalent academic degree, you must have completed appropriate academic courses in medical physics. Then, having done that, you have to, the candidate has to undergo supervised clinical training, or what we call residency program. This takes a minimum of 2 years, takes about 2 to 3 years. But many institutions have it as 2 years program. But if you want to specialize in another specialty, that's for a particular specialty. Or if you want to include another specialty, you have to do 1 more year. That's why it's about 2 to 3 years. So all these programs must be accredited. And at the end of it all, the person would have, a clinical medical physicist would have spent about 7 years, from undergraduate, from the basic degree in physics to master's or PhD to becoming, about 7 years to becoming a clinically qualified medical physicist. So at the end of the residency program, one can be said to be a clinically qualified medical physicist, but you need to go on to be certified. There is the stage of certification or recertification, as the case may be. After certification, then there is this process of state registration. And this is where the medical physics bill is necessary for our own association in Nigeria. CPD means continuing professional development. Maybe for one to be recertified, you have to have CPD. I'll talk more about that. And certification and registration, according to IAEA 2013, that's the latest publication on the roles and responsibilities of medical physicists. The professional certification of CQMPs, as for other health professionals, should ideally be conducted by national boards. The national boards have to be maybe guided by the international board or advised on what to do and all that. So, but we lack that in our country. The international boards may grant and issue certificates to applicants who have been found qualified. They can maintain a registry of holders of such certificates and serve the public by preparing and furnishing lists of CQMPs who have been certified by the international body. And to date, I know about 3 Nigerians that are already certified by international body. So there are exams to be taken. I will talk about that very soon. A government-operated CQMP registry has the advantage that professional requirements can be implemented in a harmonized way across the country, in a similar manner to requirements for regulating other professionals, like the architects. The architects, they have what is called ACON, that's Architects Registration Council of Nigeria. There is the COREN, that is the Council for Registration, for the registration of engineers in Nigeria, engineering in Nigeria, then the Medical Council of Nigeria. So medical physics, you also have a council. So this is the bill that is still pending in the National Assembly. And we hope that with time, it will come out. I mean, it will be passed. To be qualified or certified internationally, a medical physicist has to take some exams. So IMPCB is International Medical Physics Certification Board. As a Nigerian physicist, you can apply to take this exam and become certified internationally. That means wherever you go, you'll be accepted, or you have the access, you have the privilege to be employed in the hospital as a medical physicist. The exam is not free, you have to pay, and there's this website for it. But the education requirement to take this exam is an advanced degree, either master's or doctorate in physics or medical physics, or an equivalent degree in an appropriate physical or engineering science discipline. So if you have a master's in physics, you can take this exam. If you have a master's in medical physics, you can also take it. That's for, and there's this professional requirements. There are 3 parts. The exam is in 3 parts. For part 1, you don't need any professional requirements. You only need your MSc certificate or PhD. So for part 1 of the exam, you don't need any professional certificates. So part 1 is designed to accredit or certify in the fundamental aspect of medical physics. As part 1 is general medical physics. For part 2, you need a professional qualification, like an evidence that you have done a residency program or that you have been clinically trained by a certified medical physicist. So part 2 is designed to accredit or certify in a specialty area of medical physics, such as radiation oncology physics, diagnostic and interventional radiological physics, nuclear medicine physics, non-ionizing radiation physics, that includes MRI and ultrasound, then medical health physics and physiological measurements. Parts 1 and 2 are usually written exams. Nowadays, I think from this year, 2020, because of the COVID lockdown and all that, they couldn't do the exams physically. So I think from this year, the exams can be taken online, can now be taken online. Unlike before that, you have to go maybe to ICTP to take the exams or to somewhere else. But from this year, 2022, the written exams can be taken online. Part 3 is designed to accredit or certify fitness to practice clinical medical physics in a designated specialty. You have to pick a specialty, and it's usually an oral examination. Nowadays, they do it by Zoom, but you have to be the only one in the room. Once they notice there's somebody else with you, you are disqualified. So it's like that. So at the end of the day, if you are able to pass the 3 parts, the exams, you'll be qualified, you'll be certified, you'll be a certified medical physicist, internationally certified medical physicist. So you can work in any hospital as a medical physicist anywhere in the world. So there is this, I hope you are still hearing me.
Yes, we can hear you.
Oh, okay, thank you. So there is continuing professional development, that's CPD. CPD is one of the essential measures in maintaining professional competency, particularly for certified CQMPs. Its goal is to keep professional knowledge and skills up to date. You know, you are expected to keep your knowledge of changing technologies up to date. You know, there was a time we were doing IMRT in radiotherapy. We went to IGRT, now stereostatic and all that. The technology keeps changing and changing. So you as a medical physicist, you have to keep your knowledge up to date and your skills up to date. So it's also a very good way to recertify you, you know. That's at a particular time, you have to recertify yourself. There has to be, you have to show evidence of having gone through some kind of continuing professional development. The concept of CPD varies from country to country, according to IAEA, but in general, it includes participation in educational and scientific activities, such as conferences. You have to show evidence that you have gone to a medical physics conference, symposia, courses and workshops, and education and training, and other education and training duties of medical physicists. You have to show the evidence. Then research and development, you have to publish your findings and show evidence of publications in journal articles. So a formal CPD program should include an evaluation mechanism, such as a credit-based system, where CQMPs are awarded a number of points for each activity they participate in. Recently, IOMP had a 1 week of webinars in which I personally participated in it. That was in May, I think May 9 to May 13. And for each webinar, a credit point was assigned to each participant. So for countries that don't have a certification system in place, like our country, a voluntary CPD program is highly recommended. You know, that's what IAEA says. So we can, like the webinar we are having today, people have spent time, you know, you are spending your data, you are spending your time listening to the webinar. It should not just be in vain. You know, that's what IAEA is saying. You should have a credit to yourself for attending or participating in the webinar. And I think we can establish that on a national level. That one does not require any bill from the National Assembly. It is something we can do within ourselves. So education and training. Several IAEA publications that support the education and training of medical physicists include the Technical Course Series 37, 47, 50, 56, and this recent Human Health Series number 25. Member states such as Nigeria are expected to adapt these documents to national situation when establishing programs. That is, like if you want to establish a medical physics program in your university, you have to adapt to these documents, and also for residency programs. There is a recommendations for harmonized postgraduate academic education and clinical training of medical physicists in Africa has been published. And this is, I have the book here, and it's for African Regional Cooperative Agreement for Research, Development, and Training related to nuclear sciences and technology. It is a book on academic and clinical training programs and portfolio for the regional training in medical physics. This means that all the medical physics programs in Africa should follow this harmonized postgraduate outline or program rather. So the goal is so that the medical physics profession will be recognized in African region. When we have a harmonized program for medical physics, you go to University of Abuja, medical physics department is the same course content or the same program. You know, you go to University of Ibadan, medical physics, it's the same program. University of Lagos, the same program. So they want it to be harmonized. And you go to Ghana, the same program. The same program is there. The same courses should be taken by anybody that is undergoing MSc medical physics, for instance. So that is what IAEA has proposed, that will help us to be recognized as medical physicists in the African region and in our nation. So the documents provides clinical portfolios as a guide for medical physics residents and supervisors. So in it, you also have the portfolio for residency training. So few organizations are developing websites that provide adequately reviewed material that can help current and future medical physicists to advance communication in science. Most of the things, some of the things you find online are not reviewed. Some of them are not reviewed, but some are reviewed materials that can help us in our field. So it's better you look out for those that are reviewed. Training activities in medical physics, according to IAEA, are listed below. IAEA has training activities for individuals. They have fellowships for individuals, they have training courses and workshops, e-learning platforms for individuals, and webinars. And these IAEA training resources are free, and they are available at this website. They also operate national training courses. IAEA also operates national training courses. They operate regional training courses, and they have interregional training course on medical physics located at ICTP, International Center for Theoretical Physics. The IAEA ICTP joint courses are an efficient method of organizing training events within the area of medical imaging, especially in medical physics, and is open to professionals from around the globe. I personally have been a beneficiary of these courses, IAEA ICTP courses. It has really helped me in the area of medical physics. I've attended several colleges on medical physics, and I've attended several IAEA ICTP joint courses on medical physics, and it has really helped me in my profession. In medical physics training, the continuous professional development and training of medical physicists working in medical imaging and radiation oncology is vital to ensure the safe and effective use of radiation in medicine. A problem in medical physics education around the world is the separation between the classroom, in which the learning occurs, and the clinical environment in which the knowledge needs to be applied. So to a large extent, most medical physicists in Nigeria are not clinically qualified. And as of 2020, only 10 universities in Nigeria offered academic degrees at MSc and PhD levels in medical physics. That's the ones that are related were excluded. These ones are majorly medical physics, like MSc medical physics and medical physics related PhD. So this finding was documented by Igeto 2020. Only 10 universities out of about 170 something universities in Nigeria, federal, state, and private inclusive. So the organizations that support education and training in medical physics are many, but I've listed just a few here. IAEA is the number one. The IAEA Dosimetry and Medical Radiation Physics section develops training materials, clinical training guides, and online resources. It also regularly organizes training courses and workshops on medical physics. The section also supports education and training of clinical medical physicists and of staff working in dosimetry standards laboratories. There's this IOMP, International Organization for Medical Physics. The set of references developed by the IOMP Science Committee covers the medical physics aspect of radiation therapy, medical imaging, nuclear medicine, and radiation safety. I want to cite an example of a typical training that IAEA supports at ICTP, and this is called Masters in Medical Physics, ICTP Masters in Medical Physics. ICTP and the University of Trieste offer a master's program in medical physics, a 2-year advanced training program in the field of medical physics, and it is co-sponsored by IAEA, supported by IOMP and IFOM, in collaboration with the University, Trieste University Hospital. And how do you become a participant in this college? I'm citing this example because a lot of our students have attempted to, have attempted to be a part of this program, but they never succeeded. Then on a personal discussion with one of the coordinators, I learned that there is a problem the problem is from our country. So that's why I decided to cite this as an example. What is the selection process that ICTP uses? The selection process is based on age, academic title, research activity, professional experience in the field, and letters of recommendation, and other factors as nationality and gender. Our students, most of the time, they pass the first point, age, everything, they're okay. They are pre-selected. They go to the embassy checks their documents and testify that their curriculum of study here for physics is equivalent to the one in Italy. That's the one they call Laurea Specialistica. So what is the problem? Why are Nigerians not selected at the ICTP Medical Physics Masters in Medical Physics program? So I was told that IAEA supports limited number of qualified applicants through interregional technical cooperation projects. The pre-selected applicants from countries having an active TC project, country like Nigeria, will be requested to submit the nomination to IAEA through the established official channels using the IAEA nomination form. This is where they usually drop Nigerians, because the established official channel, I don't know, maybe it's the National Atomic Energy Commission, they don't send nomination to IAEA. They don't nominate people for this masters in medical physics. So our slots, it's only 1 or 2 Nigerians that have successfully passed through or obtained masters in medical physics from IMPCB. That was at the earlier stage, at the early stage of the program. But later IAEA insisted that if there's no nomination from Nigeria, then they are not going to select anyone. So that has been the case for some years now, to the best of my knowledge. There are other resources you can use for training and for educating yourself. There is SPROS resources. They are open access and available to all at no cost. That's the link. And they are usually a collection of classroom visuals, modules, and textbooks. Advancing medical physics through research and development. Research and development of methodology and instrumentation for diagnostic and therapeutic applications are among the major responsibilities of medical physicists. IAEA has something that is called CRA, Coordinated Research Activities, and this contributes to human health program. They contribute to human health program by stimulating and coordinating research in selected fields of radiation medicine and nutrition. Research and development-oriented activities also pertain to CPD, that's continuing professional development, including individual contributions to journals or books, publications, and referee. So if you do research, you are in a way contributing to your professional development. There are different modes of conducting research. Research, according to the dictionary, Longman Dictionary, is a serious study of a subject in order to discover new facts or test new ideas. Research may be conducted as collaborative research, that is jointly developed by 2 or more individuals, institutions, organizations. Research may be conducted as contract research, when a request is made by an industry or governmental agency for a specified research project, and can be a sponsored research where granting agencies advertise a call for applications, which are normally peer-reviewed. Then research can also be conducted as a form of consultancy. This involves buying the skills and expertise of specialists to work on a specified project. There are some criteria for a scientific research. A scientific research should satisfy some of the following criteria. The purpose of research should be clearly defined. Excuse me. Excuse me. Research procedures should be described in sufficient details, keeping the continuity of what has already been attained. Then there has to be procedural design or methodology, which should be carefully planned to yield results that are as objective as possible. Any flaw in the methodology should be reported with complete frankness. There is no need to tell lies about it, just report it as it is. And the effects on the findings should be reported. Then there is analysis of data, which should be sufficiently adequate to reveal its significance. Also, the method of analysis used should be appropriate. Conclusions, should be confined and limited to those justified by the data of the research and nothing else. Okay. There are some challenges that are usually encountered by medical physics research in Nigeria. And I've tried to list some. I should have put shortage of fund as number 1, but directly is the last one here. So lack of adequate scientific training in the methodology of research. You want to carry out a research, you have to understand and know exactly what you want to go and do there. If you want to collect patient data, you have to know how to go about it. Then insufficient interaction between university research departments on the one side and private establishments and government hospitals and research institutions or industry on the other side. So there should be a satisfactory liaison among all concerned. So there is reluctance by private establishments to supply the needed information to researchers. Sometimes when some of our research students go to private hospitals, they usually feel reluctant to allow them to take any data from their machines or from their environment. So we have to like generate confidence that any information or data we get from them will not be misused, that it's going to be for research only, purpose only. So research studies sometimes overlap. So there should be a proper compilation and revision of existing research area. What has been done in this field? Has somebody else worked on this field? Is somebody else working in this field? You find out, you Google, you go to Google Scholar, you check, you put the topic, you check if somebody else has worked in that area before, and what was the problem, what is new that you want to do that has not been done before in that field. So libraries don't usually have adequate books and journal articles. So you have to look for online materials. And I've showed you links that you could use to get some free online materials. Then shortage of funds is the main thing for basic research. So what do you do when you don't have funds to even do any research? You look for research grants, you look for sponsors, and you seek for scholarships. If you don't have money to your personal money, most of us, we use our personal money to conduct research. That is part of why ASU is on strike anyway. That's a matter for another time. So what is the future role of medical physicists? I think enhance safety, precision, and innovation through clinical application of physical sciences is the future role. And there is this document called Medical Physics 3.0. It's MP 3.0. It is an initiative of the AAMP, that's American Association of Physicists in Medicine. And it starts with devising a framework of strategies by which medical physicists can maintain and improve their integral roles in and contribution to healthcare and its innovation. The major goal of MP 3.0 is that all clinical medical physicists should practice as scientists and as healthcare providers with professional competency that utilizes scientific principles and an ethical mandate that advances the quality of care. So it's not all about machine. Now they want us to be more involved with the patients themselves in a way. They advance the quality of care to the patients. Let the patient be able to say, oh, this is my medical physicist, walk into the hospital maybe after 2 or 3 years and say, oh, this is my medical physicist, because of the way you have related with the patient. That's ethical mandate and all that. So there are strategies. There are about 1, 2, 3, 4, 5, 6 strategic goals of MP 3.0. And it starts with clinical expertise, scientific expertise, educational expertise, leadership expertise, sustainability, and visibility. When we talk about clinical expertise, the goal is to expand beyond technology care to scientifically oriented healthcare service. And for scientific expertise, the goal is to model scientific innovation in all practice domains of medical physics. Educational expertise has to do with the goal to achieve highest quality education in order to effectively empower others to improve health. Leadership expertise is to practice leadership and management skills. We should start learning how to practice leadership and management skills, begin to interact with those that are like up there, interact with them, and be confident and show effective practice of medical physics. So sustainability goal is to enable the practice of MP 3.0, which the aim is to discover and model practices that can be achieved. So visibility has to do with the goal to articulate the value of clinical medical physicists and medical physicists generally. Visibility seeks effective promotion of the medical physics profession, to healthcare providers, to administrators, and to patients themselves. So that is what Sameh et al. Has been working on. The conclusion here is to look at how to advance medical physics profession. Training opportunities must be enhanced, and also the level of clinical medical physicists in the country. provision of funding, there should be provision of funding for physicists in residency programs. But I think the government is responsible for that. Maybe after the bill has been passed, we should have some kind of funding for the Medical Physics Council. Then the understanding and cooperation with some universities for harmonized postgraduate programs in medical physics and a view to engage in collaborative research should be established. So many universities should be encouraged to start running postgraduate programs in medical physics. There should be an establishment of partnership with foreign institutions towards enhancing training opportunities and knowledge acquisition. There are many foreign institutions that are ready to assist medical physicists in Africa. And the global health, I think global health catalyst is one of them, and there are others. If you search online, you'll find them. Then the National Professional Society, according to IAEA 2013, the National Professional Society, like our own society, Nigerian Association of Medical Physicists, can play a major role in organizing and accrediting CPD events. I said that earlier. Then NAMP should cooperate or collaborate with relevant government agencies, industries, and private sectors in the area of trainings, research, and development. Thank you for your attention.